Hello, everyone, and welcome to Mind Your Mental, a podcast that seeks to educate, empower, and uplift those seeking guidance through the monumental world of mental health. I'm your host, Raquel Martin, a Ph.D. candidate in medical and clinical psychology. This podcast is not meant to be a substitute for a relationship with a licensed mental health clinician. Thank you so much for tuning into the show, and I hope you enjoy it. Okay, hello everyone, and welcome to Mind Your Mental podcast. Today we have another amazing guest, Dr. Jessica Jackson, who I actually met. I forget when we met. It was a couple years ago, but it was at a diversity training thing for research, because learning never stops. So Dr. Jackson graduated with her Ph.D. in counseling psychology from New Mexico State University with a minor in integrated behavioral health. She completed her pre-doctoral internship, which is what I'm doing now, guys, at UCLA, and is currently completing her postdoc fellowship, which is what I have to do next year. Pay attention to all the training in clinical psychology at the VA in Greater Los Angeles healthcare system in primary care and mental health integration. And she also works with substance use disorders, which is great because there's actually not that many individuals who specialize and are able to get, specific training in it. A lot of you people out there are struggling with substance use disorders. There are a lot of individuals who specialize in it, and it's really necessary because it's a different kind of work. She also has served as a virtual mentor and student liaison for the Society of Psychological Study of Culture, Ethnicity and Race, APA Division 45. And I remember seeing your name before I met you because you would always send out the emails for Division 45.
Probably.
So I remember you before I even met you because I'm like, I feel like this might be the same person. So she's also a practitioner-scientist advocate, and her research focuses primarily on centered on culturally competent clinical practice. But there's also, so I want you to explain it because your sports psychology, your dissertation thing was really cool before we get into art stuff. But I think it's so unique. So I'm going to let you introduce yourself and then also talk about your other experience with the integration of sports and mental health as well.
Got it. Thank you. I'm super excited to talk with you today. I think you kind of covered everything about, who I am. I think, our formal bios, but basically I am a postdoctoral fellow and I am almost done at the end of the summer. I'm working to be a licensed psychologist. I'm excited. That's more exciting than graduation. It's finishing. It's I'm finally done. I am really interested in substance use disorders. I've actually done that work for a while. I have my master's in clinical mental health counseling too. And I'm kind of what they would call a generalist. There's very few settings I have not either worked in or done a practicum in, from university counseling centers to hospitals to community clinics. I've done a lot of work in jails and a prison, probation. Now I'm at a larger federally funded hospital. So I'm just really excited to talk about mental health and passionate about it. You asked about my dissertation, which my dissertation doesn't relate to any of that work, surprisingly.
It was so cool when I heard about it. So it's just because the NBA actually, they have this whole new, what is it? I don't want to say category, but they're doing a specific thing specifically for mental health, not just about their their members, but also the community too. And they're actually the first. I feel like they're the first actual sports organization that I've seen have a organization for it, primarily solely for mental health. And I was just it's really cool because I don't think a lot of people think about the stressors, and they're talking about professional, but it starts. You focus on college, right? So it starts at college level or high school level.
Right. Agreed. So I really focused on race-related stress with athletes. I think we know athletes have a ton of stress in general. And I don't know that people always recognize it because we see a lot of it as their privilege. They get special treatment on campus. People feel like they do. Often a lot of athletes don't feel like they do, but people feel professors let them slide on things. They have scholarships, so they're not paying tuition, or they're not having to pay for their books. And so people perceive that they have a lot of privilege. And so for me, I just really wanted to look at, for my dissertation, what about the oppression that they always face, especially for our Black males. And so my dissertation, I got a student research grant from the NCAA to look at race-related stress among Division I Black male athletes. I really focus on Division 1. Not that Division 2 and Division 3 has it any easier, but just for research purposes, to be able to really parse out the types of stress that they're experiencing, we focus on Division 1, and just looking at their experiences of racism. The analogy that I use is like you think about a football player who has to go out on the field. Their job is to block for their quarterback. Your job is to catch the ball. You have a scholarship. If you do not perform, you lose your scholarship. What happens when you're off the field and somebody yells a racial slur, which we know happens all the time in the major
Yeah.
leagues and college, and no one on your team defends you, and you still have to go out the next day and do your job, despite the fact that you feel a type of way about people not defending you, or other people using the racial slur, or having people say things to you on campus or make assumptions about your height, your size, that you're not smart, and no one defending that, and you still have to go out there with your teammates and act like, you know what, it's all good. And so really looking at like the stress that that can take on our Black male Division 1 athletes. And it was a mixed method study, and it was a lot of fun to do. And we did find that they have like higher experiences of racism. We did find that it does influence their psychological distress, primarily looking at depression and anxiety. And the other thing that we found is on the qualitative, we had a lot of themes, but a lot of it was like feeling exploited, feeling like they're not human, that they're like a tool. So basically knowing that if I mess up, they get rid of me. They don't see me as a human. People refer to me as, a plow, or they referred to me as this person that can take somebody out. And so even when they treat me, it's like, can you perform? It's not about who I am as a person and what that experience has been like. And even being on teams where they feel safe on the team, and as soon as they set foot in the community, they feel that they're a target, and what that is like for them. It is a lot of fun to do. I'm glad a lot of people participated in the interviews. It was really interesting.
Yeah, I mean, the dichotomy of those experiences, like feeling like you're wanted on the field for one thing from a school, you got fans screaming your name, and then as soon as you step off the field, the fans will be like, they could be screaming slurs. Like it's ridiculous. And I'll be honest, I was one of those people who originally thought like, oh well, you're privileged. Like, oh, it's so bad. You get like a full ride where like I'm on a
Mm-hmm.
scholarship and you get to, have people adore you and deal with you and everything like that. But it's never that black and white with anything in life, and especially with people of color, where you feel like you're just being used for your body. I saw it one time. I forget what it's called. I don't know what it's called, but it's in football when
Mm-hmm.
they're like checking their bodies and checking their weight and
Oh,
doing
the
this all stuff.
combine.
Yes, and I
Yeah.
saw it compared to being on, like being in slavery, and when they
Mm-hmm.
check to make sure you can go on the field. And I was just like, dude, I never really thought of it that way. Like it's someone sees it as that extreme because you're just being used for your body and you have to perform, right? Or you're gone
Mm-hmm.
in that sense. And I was just like, I never looked at it from that perspective, right? Like even when they were doing that whole argument of like, should college players be getting paid? And I was like, no, that doesn't make any sense. But then someone explained it to me, like, think about all the money they bring in. Think about all the
Mm-hmm.
money that these students bring in. Okay. And like, think about how it is their job. Like they have school and stuff like that, and they have tutors, but they also have to work. It's so hard to be on a professional team, like a professionally with a college team. Like it's not all sunshine and rainbows. And you mean to tell me that when they leave this place, they have no savings? Like if
Right.
they don't make it to the if they don't make it to professional sports, which a lot of people don't, they have nothing. And if they didn't do well in school, which sometimes they get passed by to not do well in school, because it's like, well, what are they going to do? They focus their entire life, this past 4 years, on this. They didn't make it to professionals. They don't have the best degree, and this is all they really focused on, and they have nothing. And I
Right.
was like, you know what? I kind of do think they should get paid. Like, I'm
Yeah.
not saying it should be a ridiculous amount, but sports just seems, I don't know. I've never really gravitated towards it. I've never really, I've always had like a kind of bias against it because it just doesn't seem like people take care of their players well, and not just physically, but mentally. And then after they leave, and it's just, I just feel like they get dropped off, and that just has never sat well with me, in my opinion. And my husband watches sports all the times, and I'm like, yeah, this is great. It's great for the LeBrons and the Steph Currys and that, but there's only one LeBron and there's only one Steph Curry. And they're like,
Yeah.
it's not
Yeah.
the same for everyone. And I don't think they get taken care of well, especially watching football. And then when they're having the post concussive syndrome, it's just, I don't know. Sports, professional sports, I watch them because they're always on in the house, especially now it's playoff season, but it never really sits, it's never really sat well with me as like an organization.
Yeah. And I think that people don't always realize that it is a job, just like the same way that you and I went to school, like our goal was to obtain a PhD. Like we did all these things to get to that point. For many student athletes, they have been playing their sport for years to obtain a scholarship for college with the goal of trying to get into the major leagues. Like that has become a job. They practice the same as we study all the time. Like they do all of these things. And so, kind of, as one of the participants in my study said, there's no sense of belonging for them once they do make it, because for the ones that identify as Black or other people, student athletes of color, the thing is like you're always taught that you have to work twice as hard, 2 and 3 times harder than everybody else. And on the same token, you are always shown that you are less than. So it's like this constant striving to be the best person on the field. And when you experience racism, you're also getting the message you're never going to be good enough. And you look at like the lack of quarterbacks, Black quarterbacks in college and NSAL, the lack of Black coaches. Like the NBA, I think, does a really good job of it. And they also are focusing on the mental health aspect, which I think is awesome. But I don't know that we always recognize it's not just a game for them. It is a way for a life. For many student athletes, you have people that couldn't afford college otherwise. And so also imagine the mental health for somebody who's sitting in a college dorm where you have a safe place to live, a place to sleep, guaranteed food, and your parent, your mother, your father, your siblings back home don't currently have electricity. You don't know how they're eating. Like that's stressful. Like how am I being comfortable knowing that they're not comfortable and there's nothing I can do about it right now but know it?
Yeah, especially so where I'm at in Baltimore, there are so many kids who are, I see high school students and they're like, oh yeah, my goal is to like go to college and play professional sports, and it's like it's a difference in, say I have like five teens that are all like playing sports and they're all trying to go out for just getting a college scholarship. There's a different level of like like hunger and dedication that they have because this is their only way out. Like this is what
Mm-hmm.
they've been working on their whole entire life. This is it. And it's not their only way out. It's their family's only way out. Everything is on their backs. And like the stress that they have with that, when I'm trying to help them focus on school, and they're like, I was in the weight room. I got to be in the weight
Mm-hmm.
room. And I
Mm-hmm.
was like, well, is there any way to balance it? No. There is no way to balance it. And it's like
Mm-hmm.
it's like there's only so much I can do with that. It's like, oh yeah, I fell asleep in class. I worked out twice. Work out twice a day. And then I have practice. And then I have to remember plays. And then I have to watch tape. And then I have to no, I'm exhausted. But then I gotta get up for the game. And this isn't just my way out. This is my family's way out. And it's not
Mm-hmm.
like I'm the only one saying it's my family's way out. They are telling me every single day that if I don't make it, like it's the worst thing in the world. And that's just to get to college. And it's just the stress with that.
Yeah.
I don't know. When I heard about you when we were at the conference and I heard about you, I was like, man, that's a really cool topic because I don't think it gets talked about enough because I think a lot of people do see it as a privilege. And to get to the NBA or the NFL or like the
Mm-hmm.
baseball league or like soccer, like it is a privilege, but there's so many people who don't make it there. And we don't see how many people get like left on the cutting room floor, as a sense, like, that what happened to them after. And to me, I always think about the kids, what happened to them after. Like when you have been playing the sport for forever and you didn't make the team professionally and you don't really know what you're doing because you went to class but not really, you did enough to pass, but how easy is it to really succeed? How can you really excel at a professional sport where so much is expected of you? It's your job. Like what is it, a 60-hour a week job on a good week,
Mm-hmm.
and going to class, which is also a full-time job. So to be real, I don't know how many people do great at it, but it has to be really hard to excel at your classwork, which you're actually in school for, or your job, because the sports are your job. So
Right.
I just always think like, oh my God, I can't
Right.
imagine the stress. And then when you get to professional league and the stuff that I be seeing with like people getting slurs screamed at them or getting
Mm-hmm.
touched by people while they're playing the team, it's just like they act like they're animals in the zoo. There was this one scene where Russell Westbrook, this kid just like
Yeah.
touched him or something, and he was like, you can't just let your child touch people. Like they're not animals, these are people.
Right.
Like it's
Right.
just like
Right.
I
And
can't
then
imagine.
imagine, because there are people that are human. So imagine that they're the same people that we treat in general. They're the same people that are going to have trauma, PTSD, anxiety, depression, that they might have even some OCD. They might have like all kinds of things. Money doesn't make that go away, except now you're on a platform and a stage that everybody can see how that is playing out for you. So it's not just now that I have depression and I play for a large university and everybody, I have to do, news interviews and I have to do all of these things and practice and go to school And I'm dealing with depression just like the average person. And that's now playing out in front of everybody. Right. And so then often we also don't think about that, how difficult it might be to seek help in that situation because everybody's going to know. And there's so much stigma about it and everyone's going to see it. Or you've made it to the NFL. That childhood trauma you experienced does not magically disappear because you now make millions of dollars. If anything, it might
Yeah.
be exacerbated.
Yeah, and then people like me before think it's so easy. Like,
Mm-hmm.
"Oh, what are you complaining about? It's so easy. You're fine." Like I over here, you get to go to the cafe every single day. My meal plan says I can go 4 times a week
Mm-hmm.
max. Like, and I had to pay for that. Like, it's just I think it's really like important work. I like the fact that they're integrating in sports. And I think it's so cool that you got to focus on that in your research. Because I for real, like we hear a lot of research topics like I do, and some things like are very unique, some things are repetitive, but yours is like really unique. I was like, man, I don't even think about sports in that sense when it comes to um that aspect, because with us in our community and because there are so many opportunities that are taken away from us, sports are a lot of the time that's the main way you get told that you can make it out, right? Like I
Mm-hmm.
think even growing up, like it wasn't like that with women. Like we're pretty I think women are really much and little girls are pushed a lot towards their intellect. I think they are. Like I've always been told to like keep my head in the books, and I've always been told like you can be a doctor or a lawyer or whatever, like you can be whatever you want. But like for the little boys around me, it's like, oh, okay. Do you play sports? That's always the first question.
Mm-hmm.
Like, do you play sports? And I feel like I noticed that very early on that it was a difference between like what people said to me as like a black girl versus what people said to boys as a black boy, especially if they were like tall and lanky or if they were like stocky. Like they don't say like, oh, you could be a doctor or a lawyer. They're like, oh, do you play sports or do you do this? And it's just like from the beginning, that's what we're telling kids. Is that this is our expectation of you. Like girls, you got to use your brains, okay? Like that's what you have to do. Boys, like use your brawn, use your body. This is what you have.
Yeah.
And I can think about how damaging that is to hear that from the very beginning. And I think a lot of people aren't educated in how like that I don't know, like damages kids going forward, or it kind of it puts them in a
Yeah.
box, and then you don't think you're putting them in a box. Like in your mind, you're like giving them aspirations to go harder, but it's in with one thing. I forget what J. Cole thing he said. He was like, I ain't have a jump shot, so I had to learn how to rap, or it was something like that. And I'm like, well, there's so much more. Like,
Yeah.
like, what do you do with the kids? What do you think happens to the kids who they know they can't play sports, they know they can't rap worth a darn? Like, well, what do we tell them? So I feel like working with kids, I always see that. And I'm like, oh, yeah, you can play sports. You can also read a book.
Mm-hmm.
You can be a lawyer or a doctor. You can be astrophysicist. You can be whatever you want to be. You don't have to play sports. Like, it's okay. But I just think it gets pushed. It's very different on little boys versus little girls growing up. There's a huge, like, they're on different sides of the spectrum with the way that people encounter them. And especially since Black children don't get to be children for long,
Yeah.
it's just crazy to me.
Yeah.
But yeah, okay. Thanks for sharing that because I really
Mm-hmm.
liked your dissertation. I'm a nerd. I don't care. I feel like everyone knows at this point. So
Same, same. I don't know that you can go through a PhD and not have some nerd in there.
you have to, right? Like there's no way. So I was just like, ooh, this is so cool. I can't wait to hear about this again. Um, so you did mention that you're a generalist. You get to work with so many different things. We
Mhm.
talked like a little bit about what you get to work with, but I like the fact that you get to focus on and you work with adults.
Yeah.
I feel like I've had a lot of kid people lately, so finally someone working with adults. um, you get to work with substance use disorders, and you said you have a lot of training in that. So can you talk more about that? Because I think people are not really identifying with the fact that they have substance use disorders. I think they
Mhm.
really think of like certain behaviors and stuff are normal as like a coping skill, and it's not.
Yeah. I
So
think
if you had to leave people with like, here's when we think you need to kind of work on this, what would you say?
so the analogy I use all the time is like, first of all, I let people know the diagnosis doesn't mean anything. Like we get diagnosed with a substance use disorder. Really, that's just a way for us to learn how to treat you and to bill. Because people like, I don't need, that's a diagnosis. Like it's saying something wrong with me. And I'm like, well, we have to do that. And I'm like, it's really easy. The bar is really low, I think, to get a substance use disorder. And that people don't realize that is it's like a bee sting, right? So if you walk by a bush and there's a bunch of bees and you get stung, you learn to avoid that bush. You're like, I'm not going to keep going back to that bush, right? That's a consequence. Like, I don't want to keep getting stung. So we change our behavior. If you're using a substance, be it alcohol, marijuana, meth, coke, heroin, Xanax bars, abusing any of that, and you have a consequence and you continue to use it, that indicates a problem because you wouldn't go back to get stung by the bee. You would change your route. You would do something different. I don't want this consequence. So when people are using substances, you can get substance use disorder. I think it's mild, moderate, and severe are the three. And then based on the substance that you're using, to get just a mild diagnosis, A, you're having difficulty cutting down, but B, there's consequences. That's a primary thing. And so when I have people that come in and they've got a DUI, they got written up at work because they're late, or their interpersonal relationships are falling apart. I'm like, here's a consequence that is directly connected to this use, and you're continuing to use, that indicates that maybe it's time to get some help because you're not able to stop, even though it's like causing these problems in your life.
What do you think? How do you have a personal opinion on like the impact of? So, and you're in California, so this is. I feel like you already know where I'm going. Do you feel like there has been? I know there's a change in the use of substances clearly, with marijuana, with it, it's legal out there, right?
Yeah.
Do you feel like people are using that and it like is a way to get over other drugs, or because like one of the ways, like one of the things we were looking at when we were trained, when it came to substance use and we were looking at like the NA model and stuff like that, is like one of the things is like you shouldn't be using other substances, right? Like if you, even if it's like it's heroin and you're like drinking alcohol instead, like you shouldn't be doing that. And that's in their abstinence only model. So there are different models, but looking at that, how do you think that, does that play out differently in California with there being so much access to marijuana? Do you think that it kind of blurs the line? Do you think it makes it difficult for people? Because I mean, I can only imagine. I haven't been to California in years, but I can only imagine like it's just played up a lot. Like you just walk in somewhere and you don't have to smoke anything. You can buy edibles. You can buy, I mean, it can be, there are like whole restaurants dedicated to everything being infused. Like it's not like where you had to like roll a blunt or do all this stuff. He's like, oh no, I'm this lollipop is this marijuana. There's marijuana in this. I'm just eating this.
I think that people do that. They're like, oh, it's like legal, but I'm like, there's so many drugs that are legal. Like people do inhalants, which are basically like things in your kitchen. Like they're legal and you buy them, you have them, and you can get high off of them. Or when I lived in Houston, people would do lean, which is like alcohol and heroin or cough syrup, right? And they're like, well, this is legal and I can do it. It like alcohol, it messes up your body. So when people say the thing about marijuana, I'm like, there's a ton of things that are legal that still are harmful to you. And I think marijuana has gotten this reputation or cannabis really, like that has gotten this reputation that it is safe. And I think we're only really starting to do more research as it's become legal because, it's kind of hard to get people to participate in studies with something that they know is not legal. That there's a link to depression. It is a depressant. And that's one of the things that I tell people, even when I've worked in university counseling centers and things, and people come in, and that's a question that I ask when they smoke. How much are you smoking? How often? How long have you been smoking? We know the brain is not fully developed until around age 16, 17. So if you started smoking marijuana at age 13, your brain is not fully developed. It develops on marijuana. That's going to change things. And you don't even realize because that is your new normal. So you don't know what the old normal looked like. And I think that people think that cannabis is harmless. And I'm like, we don't have enough research to say that it is harmless 65 years down the road, 75 years down the road. We do, however, know there's a link to depression. And often when I work with people and I'm like, hey, let's take a break, because I currently am in an abstinence-based program that I work in, and we also do motivational interviewing. So there's some harm reduction. I lean more toward the harm reduction, especially for people in therapy. I'm like, we can't take out something that's a coping and not put something in there. So if I ask you to stop this right away and we haven't given you yet tools to, fill in that hole, I don't know if that's fair. But when I ask people I'm like, let's take a break. Let's not smoke for 3 weeks and see if you feel a difference. People will notice a difference. They feel better. Their mood is different. Like they really can feel it physically and emotionally. And so I'm like, that's maybe an indicator that there's having some effect on your body. Maybe we need to slow down. But I think before people do that, they don't even know what it's like to not basically be high, because marijuana stays in your system for like, I think around 21 days or something like that.
Yeah, and it's more difficult with like there being more access. I think there has to be more research, and I think more the research just needs to happen in California so we can get more participants. I'm be real with you, like for real, like California, Colorado, like all
Mhm.
you psychologists, just do the research out there because you're more likely to get participants because people aren't tripping on it. They're like, "Do you smoke weed?" Yeah. And they're like, "Oh, is that bad?" And they'll know like, no, everyone smokes weed. They probably ask the scientists if they smoke weed. Like like I just feel like there does need to be more research on it because I'm seeing people do it like, and I only work with teens and kids, and they're like, I'll ask them about substances, and I'm like, any drugs, and they're like, no, and I'm like, okay, do you use marijuana? And they're like, yeah. And I'm like, well, that's a drug.
Mhm.
Like it's some people for real it doesn't register with them because it's just like everyone smokes weed and I'm like okay it's still a drug. We think about legalized thing, alcohol is legalized at 18 and alcohol
Right.
is damaging, man, like Jesus. Like
Mhm.
alcohol is damaging, so are cigarettes. And it's just like legal doesn't mean, or not just legal, decriminalized, legal or decriminalized doesn't mean it's okay for you.
Mhm.
I honestly think they're always financial decisions. Like, and just think it's just like it's a political thing, and it's a generational thing, and it's also a financial thing when you legalize stuff. Period.
Mhm.
I think about how much money came in after we stopped with the what's it called when we banned prohibition,
Yeah.
or like when cigarettes aren't allowed and stuff like that. Like it's don't it just has nothing to do with everything is about money, guys. And I feel like at the root of everything it's money, and then there's like politics and there's race in there. It's not
Mhm.
because it's better for you, it's not because it's okay, it's because look at all the places that have legalized and how much money they made. And if you even got to get even deeper into it, think about the people who are trying to open dispensaries. Who do they all look like? Think about the people who
Mhm.
are in jail for selling substances. Who do they all look like? And
Right.
like it's not, it doesn't mean it's better, guys.
Yeah.
It's just I can just see it impacting the amount of sustainability of substances, like because you shouldn't be using, if you're in an abstinence only program you shouldn't be using any other substances, but then you're in a place where you're surrounded by people who like vape or do edibles and stuff like that, and you're trying to stay off of one substance, and then you may think that one is less harmful so you go to another, right? But if you had difficulty
Yeah.
with one substance like heroin, you shouldn't be using another one anyway. And I think that'll be something specific that happens in California and other places, that it's just like, well, yeah, but I haven't done heroin in, months. It's like, what
Mhm.
about marijuana? Oh, yeah, I smoke that like once a week. It's like, well,
Mhm.
now we have another problem. Like,
Right. And they most people are smoking more than that. Normally, when I ask somebody,
yeah.
first of all, like I've learned to also like name it because I ask people like that's a part of when I see people in primary care or in substance use disorders or any intake, I ask about substances, including caffeine because that is a substance.
Oh my
Um,
God,
yeah,
caffeine is a hell of a drug.
yeah, yeah. You have to ask about coffee, caffeine, like all of those things give us information. And when I say, what about other substances? I've learned to name them because people will totally forget about cannabis. And I'm like, also, that is still a substance. And then I'm like, they're like, oh, I smoke. And I'm like, I've learned to get really specific. How much and how often? Because people often smoking to wake up, to go to sleep throughout the day. Like it's a lot. And so if you just ask, there's this idea of like, oh, yeah, I kind of smoke. And as therapists, psychologists, mental health professionals, you can't give informed consent when someone's under the influence. And people also don't realize that. I'm like, it's an altered state of mind. So even just knowing when you go into a therapy session, I can't legally, ethically see you because you cannot give me informed consent to see you because your state of mind is altered, even on cannabis. So if you come in here high, my patients know, hey, unfortunately, we're going to have to reschedule. And we can work with that. Sometimes that means you get early morning sessions because we're working on reduction, but I need you to come into this clinic sober because we cannot do therapy if you are under the influence, if you're not in the same state of mind.
Man, does that happen often?
Yes.
Well, like, okay, yeah. Well, you know what? I get, that's not surprising. I mean, they're working through a problem and they may, it's like on one hand, it's like I'm glad you decided to come to session today. On the other hand, we cannot have session today. But I do appreciate dedication. Let's make this other appointment, and be specific about the fact that like you have to be
Right.
sober.
Right.
But I
Right.
do appreciate your dedication. It's like validation, validation, validation. Stop that. Validation,
Right.
validation. Like,
Right. And we can't address like people are like, oh, I smoke to relax. So I smoke. And I'm like, right, but we can't address what's causing you to feel tense or stressed out if you're not feeling that. So when we're talking about a subject in session and you're like, that doesn't bother me, when that is what bothers you and why you smoke every day, it doesn't bother you right now because you're high. So even your emotions, you're going to be muted a little bit. like it's going to be black and white session instead of a session in color, like because you're muted. What you're not
That's a
feeling
good
everything
point.
that you normally would feel. So how are we addressing anything? And so for the most part, people tend to be good about it once I explain it to them. And I don't have a problem with my patients. So I'll ask them if I suspect that you are, I'll say, are you high right now? Are you under the influence? Or I'll be, when's the last time you drank? Or when's the last time you used anything? And they'll be honest and they also know how I feel about it. Like it's not a punishment. It is not a judgment. It is, we can't meet today though. And I tell them it's for your safety too. You can't give informed consent under the influence. You cannot agree to something when you are in an altered state of mind. Like that is just a
That's
fact.
That's also a testament to your rapport though, right? Because like some people don't feel comfortable sharing the fact that they're high. So it could be they could just be lying. The
Mhm.
fact that they actually are honest with you shows that you have a good enough rapport with them that they understand that you care about them as a patient and you're just trying to help them, not that you're trying to scold them,
Yeah.
right? Like that's why I feel like sometimes patients aren't honest with me in the beginning about substance use because they're kids and they're also just like I think they're concerned that I'm going to want to scold them and stuff like
Hmm.
that, and that's not my vibe anyway. Like I
Right.
had a whole I had a whole I'd have like a whole 15-minute talk with a kid in front of her parents, stuff like that, because she just found out that she smokes like a couple times a week or something like that. And I was like, okay, well, I'm not here to be the after school special. And also, I know you guys have somewhere to go, but the thing I focused on was I was like, how much are you smoking? Where are you getting it from? I was like, are you, the mom was just sitting there. I was like, are you rolling your own stuff? Are you doing all that? And I was like, my biggest concern is, I know kids, you guys just like hop on that whole, what is it called? Puff pass thing. I was like, people lace their things. I had multiple incidents with kids who thought they were smoking like a joint, but they were smoking a cocoa puff, which is weed laced with Coke. And like, I was like, and now you're on Coke. And I was like, so, I'm not here to be an after school special. We are going to talk about this at the next session, however, but
Right.
I also want you to be safe about what you're doing, who you're doing it with. I was like, if you are going to smoke weed, I think you need to be aware of who you're getting it from because I don't think that makes any sense. And also, I really don't think you need to be smoking with people you don't know. Like, just being mindful of that. And I
Hmm.
was just like, I'm not about to, school you on that because we don't have time for that. But I do want you to be safe because this isn't something you're going to stop today.
Hmm.
As a kid, they just smoke with each other. They just smoke with each other, and then sometimes they don't even know who rolled it or who the person who wrote it is a new person, and she's a female. So I'm like, dude,
Right.
like that's more so like working with kids. That's more so my vibe when it comes to teenagers. It's like I'm not here to be after school special because at one point you have to decide that you want to stop this behavior or work on this behavior and stuff like that. I'm here to make sure you're safe. I'm here to
Right.
tell you that did you know that people lace stuff? Did you know that this is a thing? Did you know that you don't always know where people get their things from? Do you know that it's just not safe? And it's just not safe to be around random people kicking it, doing substances, period. But since
Right.
we're talking about weed, I'm gonna talk to you about weed. And
Right.
I feel like that's helpful because when I have done work with substance use with kids, their biggest thing is they'll get adults coming in here and it's like an after school special and they'll be like, oh, drugs are bad and there's no good thing from it. And I don't do that because I'm not going to act like there are no benefits to using drugs. Like, I like wine,
Hmm.
period. Like, I like wine. I like a nice cocktail that is it's just amazing. So I'm not going
Yeah.
to sit here and act like there are no benefits. We're not even going to just talk about the negatives with drugs. We're going to talk about the positives. What do you do it for? And then also, I feel like a lot of times they don't get at, okay, so are you doing drugs to stop the bad, to start the good, or just to feel anything? Because there's different things. Like some
Yeah.
people are just feeling awful. So they just want to feel something. They're feeling awful and they just want to feel better. Or some people just want to stop feeling bad. And these
Hmm.
are different reasons. Like, how am I going to treat you if I don't know why you're even doing it in the first place?
Right.
Some
Right.
people legit just like they really just like being in an altered state of reality. Some people like for real. I just like, oh, I just like trying stuff. And I'm like, yeah, okay. Like,
Yeah. Yeah.
even like when you talk to them more about it, they're like, nah. Like I know, no, I just like trying things. Like different drugs are fun. I just like it. But we have to get to that reasoning, right? So it's just like I feel like it is helpful that you have that rapport with your patients that they're just like, yeah, I am high. Okay, we'll reschedule. Because that means that they're comfortable with you. They don't feel like they're being judged. Because if they do feel like they're being judged, they're not going to be open with you. And there's not going to be any kind of care. There's not going to be anything. They're just going to be coming just to come.
Right. And this, I would think the part about the judgment, because I think it is very easy to judge. You have someone that for anything, as you know, psychologists, anybody that comes in before us, like we're humans. And so the thing that I've learned that helps me to work with patients and for them to work on it is looking at coping not as like good or bad, but adaptive and maladaptive. Like at one point, we all have coping skills, whether it's drinking wine, whether it's smoking cannabis, reading a book, talking to a friend. Like we all have coping skills. And the thing is, like, at some point, that coping skill is adaptive. It is what we needed with given the situation we had, the resources we had. This is what I could use to get through this moment. At some point, that season of life changes, and now they're maladaptive. They're not really fitting where I am in life. So, right before I smoked because I'm like, I can't, this stress is too much. I just need to get through it, right? And I didn't have a job and I didn't have all these things. And now I have a job. This coping skill is now maladaptive to my current situation. So I need to develop new adaptive coping skills because we think of coping skills as like stagnant. Like I'm gonna have that's how we talk about it. It's like an absolute, what is your coping skill? But they're fluid because life changes, life happens. And what was adaptive coping for one season could be maladaptive for another season. And so for me, that's helpful. And like when people are judging things, is like that helped them to get through the season. That's why I was adaptive. As humans, we're kind of hardwired to survive, to get through things. So they did what they could with what they had to get through. Now it doesn't fit the season of life they're in. Let's find a new adaptive coping, right? And maybe what we develop now is not going to work for you in 10 years. But for now, it'll help.
Yeah, that's a good point because I think sometimes people think of drugs as like a dysfunctional behavior, like utilizing them, and we never even use the term dysfunctional behavior in our clinic because every behavior has a function.
Right.
Like there's a reason for everything.
Right.
We use, like you said, we use maladaptive, and
Mm-hmm.
even when we're talking about like coping skills, it's just like, okay, did you used to do this and it used to work? Okay, let's find another one. There are so
Mm-hmm.
many. Listen, there are so many skills that are going to help you. And the way you mentioned it, like it worked for one season, it didn't work for another. I love that because some things aren't going to work forever. Like it's just
Mm-hmm.
not. Breathing exercises work for me now, but they hopefully they'll work forever because they calm my nerves and they're easy to do and they can do them everywhere. But there may be a point where that doesn't work, right? Like there may be
Mm-hmm.
a point where I get to where I notice that like when I started my doctoral program, it was I had never had like a drink alone in my life. Like it was always social for me.
Mm-hmm.
Like it was just like, oh, we went out, had a drink, had some wine, came home. I had never even had alcohol in the house. I started my doctoral program. I realized that I was having wine, I think like twice a week, which isn't a
Mm-hmm.
big thing,
Mm-hmm.
but it was definitely a coping skill I was using at the end of a long darn day. And I'm not
Right.
like, and it, I didn't even notice it at first. Honestly, like he wasn't my husband then, but my boyfriend noticed it that I had like wine in the house and stuff like that. Like it was never a drinking by myself thing, but I would when I started my doctoral program, I would come home some days and just have a glass of wine and like read a book or watch TV. Whereas before it would be like, well, there's no one here to drink with me. I'm not going to
Yeah.
drink. But that was my new coping skill because this stuff was rough.
Yeah.
Like, and I was just like,
Yeah.
you know what? You know what I need? Something to take the edge off. I really do. I
Mm-hmm.
really do. So I'm going to grab a bottle of wine and like, I'm just going to have a glass today and I might have a glass in a couple of days. But that was my coping skill because like, I don't feel like going to the gym. Sometimes I don't.
Yeah.
So it's just stuff changes in different seasons. Like me being a more social drinker changed. Like it was the first time I actually realized that I had bought alcohol and not to go to a party or someone's house just because I was like, oh, this is going to be in the fridge. I'm going to chill this and I'm going to have it
Yeah.
tomorrow.
Mm-hmm. And I think that's something we don't talk about often enough. There is so much literature coming out now about the stress of being a graduate student, a PhD student, not just in psychology, across the fields, even medical. The medical field is looking at burnout, and no one's giving us tools. Everybody is touting the word self care. What does that mean when
God,
you are
yeah, I'm
also
starting to hate
telling
that
me,
word.
right? Self care, okay, but you're also telling me I need to take 6 classes to do 2 practicums, work on this dissertation, apply for these positions, like. And then you're telling me to take care of myself. What does that look like? So yes, if I only have 30 minutes a day to take the edge off on wine, then that's wine. That's going to help. It takes me 15 minutes to get dressed to go to the gym. I don't have time for that. And so
Yeah.
that is how our behaviors develop. And then we judge them and then people don't talk about them because they're like, oh, they're doing this thing. And it's like, also, that's how they're getting through. That's their adaptive. And so we can't ask somebody to give up. It's like a hole in a tree, right? Or anything else that we plug up. If we take something out, stuff is going to get through there, right? It's like if there's a hole in a tree, now we can see clean through it, stuff comes in, right? If we plug it up, that's what our coping does. It stops stuff from getting in there. We feel safe. If we out that hole, take out that plug, stuff is coming back in. We didn't give you anything else to plug it up with. So we're like, just deal, but we're not giving you anything. Like, no, that's
Yeah, and it's
not
socially
reasonable.
acceptable, right? Like, it's
Right.
socially acceptable to say I have a glass of wine every night.
Mhm.
And most of the time someone says 1, it's normally 3. But then, like, a lot of stuff is, like, we start getting judgy when it's not as socially acceptable. Like, "Oh, yeah.
Mhm.
Yeah, so I have a glass of wine every night to calm down." "Oh, okay, cool. I smoke 2 blunts every night." And it's like, "What?"
Mhm.
That's excessive. And it's like, is it excessive, Miss? I should drink a glass, but I know darn well you drink two. Like, it's just, that's insane. And then thinking about the school dynamic, our stuff is really competitive, like really competitive, like
Mhm.
publish or perish competitive, or how many patients have you seen? Like, being students is not like, it's not simple when you get to that certain graduate level, guys. Like, it's rough. You
Yeah.
feel like imposter syndrome is like everybody has it. So it's not even, I don't even know if we can call it a syndrome anymore. It's just living. It's just being a student. And then you also have to balance every single thing out. Like the conference that I met Dr. Jackson at was like something in addition to, while we were working on that, I was working on
Yeah.
my dissertation. And while we were doing that, I was going to the the gym in the
Yeah.
morning. And then as soon as I like landed from leaving that, I had to go back to like a practicum that next week. Like, this is what we have to do in the middle of work. Like, it wasn't this, I was still getting emails from a professor about research while we were in the trainings, and I had
Mhm.
to reply.
Mhm.
It's very competitive. And I think I like the fact that everything is getting mainstream about getting help, but like we've talked about before, there's also difficult things about things getting more mainstream with mental health, right? Like, with
Mhm.
the aspect of saying everything is very helpful and self-care and buzzwords, you have celebrities out here talking, which is helpful, but then I think there's also, I don't know, I think we talked, you mentioned before, like, you don't know if that's good or bad.
Yeah.
Really, like the fact that celebrities are talking more about mental health.
Right. And I do want to add something, because I don't want people listening to think that we think that like all drinking is bad. So just to throw it out
No,
there,
absolutely not.
yeah, all alcohol is not like, it doesn't mean a problem if you have wine or something. The CDC and most people, most medical, the recommendation is that if women have a drink a day, men 2 drinks a day, and I think in a week is 7 drinks. So it's not, we're not saying if you have 2 glasses of wine, like, oh my gosh, like if you're listening, you have a problem, do something about it. That is absolutely not what we're saying. And I just wanted to make that note, since we were like talking about it as coping, that there are recommendations for what's physically healthy for you, and it is typically a drink a
Yes.
day or 7 a week or something like that.
And good point. And mine was more so, it's because it was a change, it's a deviation from my norm,
Hmm.
right? So like when I am thinking about the way I'm dealing with stuff, it's a deviation from the norm. Like the fact that I didn't notice, like, oh no, I never drank by myself, and now it's like something weekly. It wasn't the worst thing in the world. It was
Hmm.
just something different, and it was
Right.
different as a result. I was able to connect it as a result to, I'm stressed, and
Hmm.
like there's some other ways to manage it. Or it's the fact that like people look at it, it's like you mentioned the CDC, the certain amount, but it's also, I didn't have a problem going a couple
Hmm.
weeks without having wine. There's also the dependence
Hmm.
aspect, guys. If you feel like you can't, like the same way you mentioned, like, okay, let's try to stop for 3 weeks and we'll see how you check in. I can only imagine there are some
Hmm.
patients who are like, I tried it for 2 days, I could not do it. And that's when you're like, and this is why we have to talk about
Hmm.
this. Like, there's a dependence aspect of it, there's a
Yeah.
withdrawal aspect of it. When you're diagnosing a substance use disorder, it's not just like how much you drink. That is a different part, that is an aspect of it, but it's also like, how long can you go without drinking? Do you have to increase the amount to get the same buzz that you used to? Do you feel like you can't go certain days without it? There's so much more to it. So we're not like out here saying, oh, you have a couple glasses of wine a day, this is awful. We're saying, as a woman, are you having 4
Hmm.
glasses of wine a day, 7 days a week? Can't go 2 days without doing that. Realize that you used to be able to drink 1 glass of wine to get a buzz. Now you got to drink 3. Like, it's like, just notice how that's different than I drink 1 glass of wine,
Yeah.
wine a day. Like, there's so many different parts to it that people don't notice. But I think one thing a lot of people do notice is when they have to buy more to get to where they
Yeah.
used to be,
Hmm.
especially with caffeine, which caffeine is such, oh my God, I kind of need to do an episode with caffeine experts too. Um, Caffeine, where people noticing that like, oh, I used to drink like, what was it, a grande or one size,
Hmm.
but now I have to drink a bigger size just to get me out of bed. Yeah, girl, caffeine is a drug. I think you guys need to know this. I'm sorry, it's rough, but
Yeah.
caffeine is a drug and it's intense. Like, these, just because it's just a legal one, like the
Yeah.
legal ones are, ugh.
Yeah, I think you just described me in grad school. That was a thing for me. Like, and then I used to like, I would talk to the other people in my cohort, and we'd have this plan, because I'm like, I would start out like the semester, fun, a latte, a small latte, going, getting through the day, and then, some green tea. And by the end of the semester, I'm drinking like venti black coffee with like nothing in it, like several cups to get to the final. And so then I would do like hard reset at the end of every semester, like, okay, now we're going to get back to this tea. We're going to try to build ourselves up. Cause then I'm like, cause you get to this point, I'm like, look, I'm just trying to get through. Don't bother me about my
You
large
do get
cups
to
of
this
black
point,
coffee.
and there are coffee stands everywhere on campus,
Yes.
everywhere.
And coffee is cheaper than most other things. So it's like, I could get a black coffee for $1.25. Good.
It is, because don't nobody want a black coffee.
Right.
When I don't drink caffeine that much, but when I do, I do love the taste of coffee and I love the smell of coffee, but the
Mhm.
caffeine kind of freaks me out.
Mhm.
Is the real thing.
Yeah.
But I do really, really, really like coffee. I'm not
Yeah.
gonna lie. But I just my lab used to do research on caffeine, and cigarettes. So
Mhm.
I kind of it freaks me out. If
And
I could, and not knowing I would probably have coffee every day.
yeah.
And just for the taste. And everyone's like, "Oh, do decaf." No.
It's not
I
the
like the
same.
buzz.
It's
I like the buzz too. Darn it.
it's not the same. When people tell me decaf, I'm like, nah, B, it's not the. And so I do try not to drink coffee on the weekends all the time, or like days I don't have to get up. And I think it becomes a part of your. Now it's a part of my routine. And I was telling somebody, I'm like, I don't even know if it's a coffee or it's like a warm mug. I need that in the morning. Like I'm used to that now. So if I just drink tea, I get the same feeling, the same impact as without coffee. So it changes.
Yeah, I totally get that. Yeah.
But you were asking about the how I felt about kind of stigma
Oh,
and
yeah, yeah, yeah,
people.
yeah,
Yeah.
the stigma. Or do you think there is more stigma or less stigma? How do you feel about, like, celebrities, talking more about their mental health as a whole?
I think it's important. I'm
Yeah.
glad that more and more people are doing it. I'm glad that, I mean, we've seen a rise in from celebrities like Mariah Carey, I think Taraji B. Henson. There's been like NBA players, Royce White. There was somebody else recently that was
Dwayne
talking
Wade.
about Dwayne Wade. Yeah, like people. I think it's imperative because I think it demonstrates to people like there's nothing that necessarily stops you from having mental health. And I personally use the word mental health well-being instead of mental illness because I think we think illness it's like sick. And I'm like, we're all going to have experiences sometimes of anxiety, depression, some sort of trauma, even grief. People don't realize like grief is heavy. I mean, it lasts a long time that may mean that you need some additional support, some additional professional assistance. So I think it's awesome that they're doing it. I think though, as a field, we're not able to keep up with the increasing demand. And I think the more that we normalize mental health, which I think is excellent, getting rid of the stigma, we also don't have services in place. Like I used to work in a high school and I thought it was a beautiful thing. We had mental health in the high school. We were not a part of the high school. We were a clinic that had a small clinic in the high school. So students in New Mexico, you can give consent at 14. So students in high school could come and see a therapist and their parents did not have to know. And so we would have kids coming to talk about suicide and depression and all these things, and it felt normalized for them. However, then you have a greater demand, and we're not always able to meet that demand. So often when celebrities start talking about mental health, you have a rise in people seeking services, and we don't always have services available or affordable services. Like insurance may cover it, but then if everybody is full on the insurance panel, no one's seeking new people. I don't know how that helps people. So I think that we, as a field, need to do a better job about that.
Yeah, and it's difficult though because I think it's hard to bring people to this field.
Mm-hmm.
I'm gonna be honest because it's rough,
Mm-hmm.
and and I think it's difficult. I think it's different. It's levels to it, right? Because like we're both studying to be psychologists. You're doing postdoc, then you're going to take your licensure. I start postdoc next year. And like, I think we don't really, oh no, I think we think about how much we went through to go through this, but it's a deterrent for a lot of people to
Yeah.
get a bachelor's. And then some people do a master's on the way, but a bachelor's and then a
Mhm.
PhD. And then you also have to do um, what is our residency, which is like the internship and the postdoc, and you also
Mhm.
have to take a licensure exam. It's not paid well,
2
guys. Like most
exams.
programs are not fully funded. You have a PhD or a PsyD, you have to do all this when like some of your friends have like real jobs at this point and real lives, and you're still in school. And it's hard to get into the field. And then we're not really. It's just, and I didn't have a mentor of color, at all. And that's one of the great things about Division 45, right? Like that you link people up with
Mhm.
mentors, which is incredibly helpful, because it's easier to feel like you can go through something when you have like a light at the end of the tunnel where you see the person who has gone through it. But I didn't
Mhm.
have that. So I think there's also times where you could have gone a different way that could have been easier. Some people don't want to go to school because debt when it comes
Yeah.
down to it. So we realize that, like you mentioned, there's so many barriers to getting care. And it's just like, what do you do? Because then you get to the point where what you mentioned, it's going to be a wait list. And then if you're dealing with like significant depression, waiting months is not going to be helpful. I don't like it's not going to help with the problem at all. But I think it is a difficult thing to get to stay up with the demand. And like we were talking about before, what do you do? Because like it's not just staying up with the demand with people who are like they don't have the right insurance. You also mentioned that like it's hard for you to get clinicians sometimes, period.
Yeah.
Like it is where you're at.
Yeah. I think so. I'm in Los Angeles and I have health insurance through my postdoc. And, you know, I think that that's also a myth, which is like a separate conversation, but therapists need therapists too. So I just want to put that out there that like your good therapists are also seeing a therapist because it can be a lot, right? Especially when you're dealing with trauma, vicarious trauma, and all those things that you take on. And so for me, trying to find a therapist, most people are private practice, which makes it difficult because they don't take insurance all the time. And then for me, wanting to find a therapist that looks like me. And I think I am blessed beyond measure that I had some awesome Black women mentors. Even more blessed to recognize how hard that is in grad school. And so when I'm looking for therapists, I actually did a little like the nerd in me, like the nerd in you, did a little bit of research. Because I was like, where are all the Black psychologists I'm looking for? And you look at like the internship match for APA to be a licensed psychologist, you do have to like match and go through that process. Last year, they had like 3,000 students went through the internship match that applied. 150, I think the number is like 148, were Black. You know, all of them weren't women. So literally, if we're being conservative, we might get 2.5 women per state per year that are Black to be psychologists. It's going to be hard
Yep.
to find somebody that looks like me. And
And if,
we need to do
that's
a
a
better
lot.
job.
Yeah, I think we need to do a better job. I think one of the ways is like better. I think we need more people in mentor positions and
Mm-hmm.
academia positions. I think we need more incentives for going to school for these things. We think we need more student loan, like debt repayment
Mm-hmm.
programs and forgiveness programs. I like the idea of just if we're saying that because there's so many repayment programs for the medical field. I'm just gonna
Mm-hmm.
put this out there, like
Mm-hmm.
me looking up stuff for like debt repayment. If I am a doctor, nurse, dentist, like I don't know if it's kept quiet, but y'all are good.
Mm-hmm.
Okay, you really are. But if we are identifying mental health as such a crisis, if we are saying that it is integral to your life, then we need to take care of the people who are supporting, trying to care for these individuals and their well-being, right? And think about how stressful it is for a clinician to have to take on multiple patients because they need to be able to make their payments on their loans or their debt. And it's like helpful. It's kind of like the concept of like if you take care of your employees, they take care of your customers, right?
Mm-hmm.
We need to take care of the clinicians. And I don't think anyone's thinking of that. Like we do need a bigger recruitment. We do need to put more focus on things other than like we were talking about before, like sports. Let's put a bigger emphasis on education. And one of the reasons why I think education isn't placed an emphasis on is because there's no money in it.
Yeah.
There's no money on it. It's like, okay, we can act like we really are just really here for all the educated people and we lionize education, but we really are here for money. That's what it is. Like people, when they mention, we talked about this before, like, oh, you're going to be a doctor, you're going to have so much money. I'm also trying to change the world. I'm also trying to change the world. But that's not what they say. They don't say you're going to help so many people. They say, oh, you're going to make so much money. Like we show what we place an emphasis on by how we pay people.
Yeah.
Period. Like that's it. Like we show what we think is important by how much we pay the people who are in that field. And psychologists and therapists and counselors, and just like we're talking about teachers and stuff like that, they do not make enough. Like you are trusting these people with like your most precious thing, your mind or your children, and we're not paying that much. Like how do we expect people to be able to take on clinicians? Because like just like you mentioned, it's not even I know we have therapy for Black girls about
Mm-hmm.
finding clinicians and therapy for Black men, but you
Mm-hmm.
mentioned that it's hard for you to find somebody, and you about to be a psychologist. Like it's just like, and you're like, yeah, I know this is a problem because I have the problem,
Yeah.
and
Yeah.
you have insurance, and you get that. What about the individuals who don't?
Right.
What my clinic has a wait list. My clinic has a huge wait list. And to be honest, I'm transferring out because I'm going on leave soon. And my patients are like, yeah, I'm okay with transferring. This one patient was like, he said, are these calls recorded? And I said, no, they're not. He said, okay. So is our daughter's therapist gonna look like you? I mean, are they gonna look like us or are they gonna look like someone else? And I was
Mm-hmm.
like, no, there are actually no Black interns coming into my clinic next year. So I was like, no, there are no Black interns. He was like, okay. We
Mm-hmm.
are actually going to have to consider the whole transfer thing. So we'll get back to you. Like
Mm-hmm.
that was a deal breaker for him. Like,
Yeah.
and there are no Black, I'm at Hopkins, I'm at Kennedy Krieger Lake, and It's very competitive, but there are no Black clinicians next year in my clinic. In the training, there's one who's going to be there part time, but like that's a deal breaker for a lot of people because we do talk about mental health and stuff like that, but we always talk about the integration of race because there's no way to not acknowledge it,
Right.
and it also makes them feel more comfortable. And the fact that like I possibly lost someone who needs, I'm going to convince them they're going to stay. I'm not playing those games because they do need more
Right.
care. So I'm like, you're still transferring. Your child still needs help. You need to get over it. But everyone's not going to do that.
Yeah. Yeah.
And I just it's crazy.
Yeah, and it speaks to, I mean, not only do we need to do better at recruitment and retention and how we're paying them, even mentors, like when you don't have a lot of mentors, I'm teaching a class at a community college this semester. And as an adjunct faculty, even these are undergrads, people who write to me on the side who are like, hey, can you tell me about getting involved in mental? And I'm like, all of that takes time. And even how we monetize time, like we don't recognize that for mentors of color, they're taking on extra burdens in order to get more people into the field, but I don't get paid for that. So if I have conversations with you, if I write multiple emails that have nothing to do with our class and all of that, if I'm helping to mentor you, I don't get any extra for that. But I do get penalized if I don't get all my other stuff done. And so if you want to be in
Yes.
academia and you're trying to get tenure or you're trying to get these things, it's like on top of, I need to do this in order to recruit and retain. And I'm like, that's one thing we can do is start to monetize that. Like mentoring is teaching. So if I'm mentoring 5 students, that's the same as if I'm teaching a class of 5 people. Like, or however, that plays out. Like there needs to be, I think, just like people can get additional money for speaking languages, I think that people should get additional money for being able to mentor a certain number of people, or because that definitely takes time. And if we don't mentor people, how do we get more people in the field? How do we help to train
Yes.
culturally competent therapists?
Yeah, I never thought about that because mentoring, it definitely would help more. And it's like it's either that or whenever because it's not like there's not opportunities to make money in our field, guys, but
Mm-hmm.
it's just like, so you might not be able to do what you want to do. Like if I decided to go in private practice, right, and I did assessment in therapy, you can definitely make more money.
Mm-hmm.
But private practice is meaning, first of all, there's a struggle with therapists and counselors and psychologists to get things covered with the insurance companies. And half the people don't want that hassle, right? They don't want to have to deal with the amount of work it takes to get approved by insurance companies to have to go back and forth when they're like, you get 6 sessions to work with this person who has depression. And it's like, this person needs a year. They don't need no darn 6 sessions. So if you go
Right.
past 6 sessions, you got to get it approved and then you might not get paid. A lot of people don't want to deal with that. So they charge you cash. They
Mm-hmm.
charge you like a fee. They do like, okay, we don't accept insurance. And I'm sure a
Mm-hmm.
lot of people who've looked for a therapist do not understand, like, why don't people accept insurance? Because insurance does not want to pay most clinicians. They want to decide what they think is coverable when it comes to how many sessions and how much therapy. Like, and they're not clinicians, right? These aren't people who have degrees and that are like, oh, the evidence-based treatment should take 6 to 8 sessions, which isn't even a thing anyway. These are
Right.
people who are like, we're not paying you for this. So we're not paying you to sit here and talk about this person's feelings, cure them, or we're not going to pay you. So people just decide not to accept insurance, just in case anyone was wondering why do so many clinicians not accept insurance.
Right.
But with doing that, with deciding to work private practice and being like, I do want to actually be able to pay my bills, you may not be able to get to work with the population that you want to work with. I've always worked in community mental health. So if I was going to do private practice, I'd have to do a sliding scale, or I'd have to do like pro bono cases because the patients that are in that population will not be able to afford my 200. And 200 is actually, if 200 is like what we're at now, but that's actually average for people to charge per session. Like 150 to 200 a session is typical.
Mm-hmm.
So they wouldn't be able to afford that. So I'll have to take on more sliding scales and more pro bono cases, but then I can't afford it.
Right.
So it's like, what do you do? Do you decide to take on these cases and not work with who you want to work with, or do you just not pay your bills?
Right. And it's hard to find a happy medium because people in community mental health are then overburdened. So it's like, do I work for myself
Yes,
or not?
girl, my caseload, man.
Right.
Like,
They're high. In every clinic I've been in, we've always had really high caseloads, and you're trying to see people and provide the best care that you can with what you have. It's like, is some care better than no care? But I think people don't realize the next time, you get a bill from your doctor, look at it, because you'll see that they bill one thing and insurance pays another thing. And that's the same thing for therapy. I can bill you $200 all I want. The insurance company is not giving me $200. They're
nope.
never doing that. And so that's also why people have higher rates. So if you only bill me and you only pay me $75 for the hour, then I still have to pay for these lights. I got to pay for this liability insurance. I have to pay for, like, there's all these things to just be able to be in this space to see you. Then there's no income. That $75 got eaten up just to be able to have a space to see you. And so I think that people don't always realize that. And they're like, oh, it costs so much money. And it's a systemic issue. I think that, at some point insurance companies are going to have to make some changes. I know recently there's been some changes in how psychologists can bill for assessments, which has been happy and helpful, and more of an advocacy arm. But it's a very real thing that I think that people don't realize, like why we have to bill or even do a super bill. I know some insurance companies, I can give a super bill after. So I can see you for a certain number of sessions and show how much you were charged total. And then the insurance company will reimburse you at the rate that they reimburse. So you're not getting all your money back, but you'll get some of the money back, which at least then it's not coming out of my pocket. So
yeah, and a lot of people don't want to deal with that, so they just don't accept insurance. I was talking to a friend and she was like, "Why don't people accept insurance?" And I'm like, "Because they want to keep their lights on." Next. Like, it's too much of a hassle because I didn't get into this to learn all of the codes for insurance and learn medical billing. I didn't want to have to do that. And then if you don't want to get into all that and you don't want to be the one who has to fight back and forth with this insurance company, you have to pay someone to do that. You got to pay like an admin assistant who also has medical billing. So that's even more money coming out your pocket. So it's just like, I mean, I really want to work with y'all. Can't accept insurance. I'm sorry. I got a family. Like paying bills is my own stressor. Like it's hard. So you do have to make these decisions. And it's very interesting because you do see all these websites that, like, you have Psychology Today where you can look up therapists or therapy for Black girls or therapy for Black men and also their stuff. But once you get through it, you do find out it's not as easy. Like there are clinicians of color, but they're not everywhere. And they might not accept your insurance or insurance at all. So you may still feel like you're stuck. And I think that's why more people are using the services like Talkspace. And there's another one because my aunt actually works for it because she's a psychologist. I can't remember the name of it. But I think that's why more people are doing that because they're just like, I can't really work with that. And that wouldn't work with my population because a lot of my patients are like suicidal or aggressive and stuff like that. And there's no way that I am going to trust that aspect of it to like dealing with teens. Because one, they probably won't come to session. Two, my teens would be texting during session. I would snap. I'm like, I can see your phone.
Right.
And three, like they're high risk, right? Like, would you trust a teenage girl with high, like, cutting behavior and their first session is online? No, because I got to come up with a safety plan. I need to find your mom for the safety plan. I need to also make sure, like, it's not a thing. So it wouldn't work with my population in the first place. Like, I can't really use those services.
Yeah. Agreed.
It's
Agreed.
difficult.
Agreed. And so hopefully we'll, start to recruit, retain, and do some things to help people to get paid more. I think that is the biggest thing. Is like, how can I get paid to recruit and retain, like, and to go in and help people to get through. I graduated from North Carolina A&T, Aggie Pride, in undergrad, HBCU, to throw my Aggie Pride. And when I graduated, and for several years after, we were the number one producer of African American undergraduate psychology majors in the country. I can count on one hand the number that I know that went on to grad school. And it's not because people don't want to. People weren't getting recruited. We were HBCU. People weren't coming in. I am grateful that I have mentors who were like, hey, let's help you get into grad school if you want to. The department chair, like people were willing to help. But APA or no one ever came during career fairs to talk to psychology majors. No one ever came to our campus and say, hey, let's put on this, this workshop to help you to go in. And I'm like, here you are, a space that has all of these psychology undergrad majors who like to be able to apply for funding and to go, and who is helping people to get in. But you'll see people go to other schools and they'll go to career fairs and they'll be like, oh, those people didn't come to APA. They didn't come to the convention. It costs a lot of money. They didn't go to this convention. It costs a lot of money. Like to me, we could do a better job of like, okay, let's pay for some workshops in these spaces where we know we can recruit. So if they're graduating a class, a 200 psych majors this year, at least can we get 50 people to apply? Like that's more than the 5 I can count on one hand. And that's not even just in my year. That's that I know total that went on. It's not a lot of us. I think that we can do better jobs with those things.
I think so too. I think you need to be in administration, Dr. Jackson. You need to make these things happen. Which is terrible because then I'll be taking another clinician off the ground. But you can't do both. You can't do both. So it's going to be hard. It's like, oh, you guys need to do policy. You need to do all that. And it's like, that's great. That means I can't practice though. So now I can't, like, we can't do it all. So it's just like, you see so many people and they're great clinicians and you're like, oh, you'll be great at this. And it's like, yeah, but if I do that, I can't practice. Or if I do that and practice, I'm not going to be practicing as much. And then it's going to be like me sacrificing my mental health. So
as they say, you can do anything you want to do, but you can't do everything you want to do.
Yes, and that is okay. Like, it's just like, you can do anything.
Mhm.
You don't need to. Just sit
But you
down
can't do
somewhere.
it all. You can't do it all.
You can't do it all. Well, this has been
Mhm.
awesome.
Yeah.
Thank you so much. So, like, okay, so one of the things they know where you can find the I will always ask to like for an affirmation and like or something to leave the guests with.
Yes.
Something that like kind of helps you through the day. Or that you find that has been like incredibly helpful for your patients. Cause I feel like you dropped some dimes, some quarters. I think quarters are better. Yeah, you dropped some quarters of knowledge either way. But what do you think would be helpful? Like something that you use or that you find that your patients like they gravitate towards that starts to be their thing.
Um, for me, I am a huge African American literature fan. Definitely the Harlem Renaissance era, and so Zora Neale Hurston is one of my favorite authors. And she has this quote that says, "There is no greater pain than an untold story," and I use that for myself and to my patients. Like as a reason for therapy. Like it doesn't matter how you get your story out, but even for me, like sometimes people you just need to listen. That's in everyday life, not even in therapy. Sometimes I need to listen because people need someone to hear their story for that pain. And sometimes I need people to listen to me, and that's a reminder too. Like when you have a story that needs to be told, that is painful. And we've all felt that before. And so I use that in therapy as a way to encourage people for the stigma. Like therapy sometimes is just getting your story and addressing your story, processing it. And for myself, that sometimes I need to sit down and listen to somebody. And sometimes I need to ask for somebody to listen to me, and that can help to reduce my stress or whatever else is going on.
Oh, that's amazing. Okay. I love Zora Neale Hurston also, by the way.
Oh,
I love and you know what, honestly, it's certain people, you know how certain people they're just so good that it's just like it's like duh. It's like,
yeah.
"Oh,
Yeah.
I love Beyonce too."
Yeah.
Like, "Oh." Like
That's good. Yeah.
it's okay, what about a favorite book or a book that you feel like is inspirational? And it doesn't even have to be an inspirational book. It could just be a bomb book that you're just like, "Love
Yeah.
it. Everyone should read it."
I would give a more recent book that I have read in the past year that I thought was awesome is Eloquent Rage by Brittany Cooper. And I
Ooh.
think the title is awesome, but she's just talking about the intersectionality of being a feminist and being a Black woman. And she talks about from the time she was in elementary school through going to her HBCU to now she's a professor, but how our basically all these identities, how they're intersecting. But as women, we have a rage, like it is a rage. And I like that it's an eloquent rage. Like, how do we communicate how we are feeling sometimes, how we're mistreated, and that the importance of sisterhood and like the importance of like she basically is talking about like being able to have other women that you can laugh with and support, like that friend group, and when you text them a picture of your outfit, everybody's like, yes girl, you look good, like everybody pumps you up, like you need that. And I thought that she just did it in such a way that has a historical context, and there's a lot of great information about feminists, but also one that's relatable and hilarious. And I just even love the title because that's how I feel sometimes as a Black woman in the world. Is there is a rage, but I have an eloquence to it. There's something that I have to say.
Yes, and you have to be more eloquent with it. I feel like that's a whole other episode,
Mhm.
but you have to have like I always have to take a breath.
Mhm.
Like
Yeah.
I think I have progressed a lot because really it really would just be me being like, so what you're not gonna do?
Right.
And then just go into that. But now it's more so a lot of times when people like when males say something crazy, I'll be like, I wonder if you meant for that to be such an invalidating statement.
Hmm.
And then just leave it there and be like, "Oh, well, I didn't." I was like, "Okay. Well, just a FYI, that's how it came across, and
Right.
maybe you can word that better." But what we really wanna be is like, "You're not gonna keep talking to me you're not gonna
Right.
keep trying me,
Right.
okay? I am not the 1 through 5, the 1, 2, 3, 4, or the 5. You can't
Right.
catch me on your but you can't say that, right?"
Right.
So I'll just be like, "Did you mean for that to be invalidating? Because that's how I received it."
Yeah.
But
Wait.
but even
Side
with
note.
that, it's just like, ugh.
Yeah, it is. And you're saying that a side note. I don't know if you've seen. It's been on Twitter and Facebook and stuff this week. The dissertation titles that they're turning into a
Oh
book.
my god!
That just
Okay, I
reminded me
wanna
of
link
that.
that
Yeah.
too.
Like what you not gonna do. It's like, yes, what you not gonna do. We're gonna have a theoretical and like annotated bibliography of all the things that you will not ever say to me again in life. Let's do this. Like that's what it
If
is.
anyone if anyone hasn't seen it, there's this feed on Twitter that's like, what if you could do like a real Black dissertation topic? Like, what
Hmm.
would your real Black dissertation topic be? And
Hilarious.
like, I was reading. Wait, no, I know I put this on my page. I want to read a couple. Okay. Because I know, guys, this is kind of diverting, but this was like the most amazing thing. And as someone whose
Amazing.
dissertation basically tried to destroy their soul,
Yeah.
um, My dissertation tried to destroy me. And you know what? It wasn't my dissertation. My dissertation committee tried to destroy me.
Mhm.
So it's like, what would your real one? One says, on God, my mama, and everything I love. An in-depth
Mhm.
look into the meaning of sincerity and unbroken promises. Like, what? Like, what are we doing here? Yes, I do have McDonald's money. A discourse into financial self-care, even if the bill money is not enough.
Mhm.
Like, you're like,
They're
that's my
hilarious.
play. That's my play cousin. Kinship ties and bloodlines with family American family. I wanted to do something like Who Made the Potato Salad, an in-depth look into the importance of transgenerational
Mhm.
transgenerational recipe passing, and why, like, if you're under 20, don't bring a dish, or like you smell like outside. A mixed
Right.
method study on the differences on like cleanliness between communities. Like,
Mhm.
I really just like, I was looking at this and I was like, I just love us as a people. Cause look at
Mhm.
this. These are all things that I like. First of all, I identify with all of them.
Right. All of
And then I
them.
was also just like, I identify with all of them. Like, I've heard all of these. There's not one of these things I have not heard.
No.
Like, so
Mhm.
you running up my light bill, examining utility management and teaching children fiscal responsibility.
Right.
Like, yes,
Hilarious. And I saw that they're
it's
turning it
amazing.
into a book this summer, that they're gonna like, they're
Are
doing
you
an edit.
serious?
They have a website and everything, which I think is beautiful. That they basically took that what went viral on social media, and they're gonna create like a edited kind of like essay book thing, it looks like, that they're doing this summer, which I'm like is hilarious because it is true, and it just shows like the resilience of Black people. But also, as someone the same who did a dissertation, I'm like, yes, if we could do our own dissertation topics, they would not look like what we're doing now. Like there are so many things that we would look
Yes.
like.
And it's just so much about like, why is this our unified experience? Why do I don't even know these people, and I'm like, yep, heard it. Yep, that's a good one. That's another one. That's a better one. Like, we just have such a unified experience, and we don't even have to know each other. Like,
Mhm.
because everyone gravitated towards this. I think it's amazing that they made a book out. They're gonna make a book out of this because they made a book out of I think they made a book out of like women's they're like Tinder like messages or something that they got from people. Like, there's a whole like coffee table book about like the worst stuff, because
Mhm.
men are like, there's no way that people talk to you this way, and we're like, okay, sure.
Yeah.
Men aren't inappropriate at all. Like,
Yeah.
no one gets unsolicited dick pics ever. Like,
Yeah.
sure.
Right.
Like, so they made a book out of like, I wonder if we could turn a book into all this crap, all this crazy stuff that men say to us. And the
Yeah.
answer is
Yes.
yes.
Right. Right. And we can monetize his brilliance. To me, the whole
Let's
thread
monetize this
was brilliant.
brilliance,
It was
and
brilliant.
it will sell out. Ooh, I'm gonna
Yeah.
have to look that up. Well, where can everyone find you? I'm gonna tag you on your Dr. Jackson Instagram page, but is there anywhere else that you think people could find you if they want to
Yeah.
you're really busy. I don't it's like
I am, but soon, soon, soon. Send me positive vibes, y'all. I'm taking the triple P soon, so then I won't be so
you're doing
busy.
amazing. Please, you're
But
gonna do amazing.
people can find me at Dr. J Lauren on Instagram, and then on Twitter, I am the original Dr. J. There's a reason that there are two different ones, primarily because I haven't changed them. I used to be future Dr. J, and then everybody was like, "Oh, now you have the PhD, you need to change it." And I was like, "This is too much pressure." So I only changed one. So it's too much pressure because so many people sent me messages. They're like, "It's not future anymore." I was like, "Cool, got it. I just graduated 6 months ago. Like, give me a minute." So I am Dr. J Lauren on Instagram, and the original Dr. J on Twitter, and website soon coming.
Yes, thank you so much for coming. I feel like every time I have someone on, I'm like, yep, so we'll figure out what our topic will be next time. Get used and listen, I feel like at this point, everyone who I've scheduled, I'm just gonna schedule y'all once every 2 months to update on like what are we talking about today? Because
Yeah.
it's just very helpful. And I always feel like there needs to be more narratives of people with mental health, but more information from clinicians of color. Okay.
Mhm.
People are out there. It's just hard to find it sometimes. But I also think it's good to hear the perspective of like, why do people not accept insurance? Like, what
Right.
is the issue? How do I find someone new? Oh, I'm not the only person looking for a clinician. My clinician is looking for a clinician and struggling. This is a real issue.
Right.
Like, you guys are
Right.
not alone. This is we are here. We are trying to find ways, but you know what? Another way to find a way is if you can't find a clinician that can help your friend, or that can help like someone in the community, become one.
Right.
Like, You don't have to get a PhD or a PsyD to become a clinician. You can get you can be a licensed clinical social worker. You can there are a lot of routes. I went this route because I'm insane. I don't know why Dr. Jackson did. Maybe she has some, you know,
I mean,
unresolved
yeah,
issues as well. But I lost my freaking mind.
right.
So you don't
I
have
wasn't
to.
thinking, but I did practice as a master's level clinician. So for those that are thinking about it, absolutely, you can get your master's and stop and be a clinician. So I advise that. So
Yeah, and there's a lot of programs for it, and I think that's actually another thing. They're increasing the number of programs for it.
yeah,
So if you need help finding a clinician, become one. Like you still got to find your own clinician, but you can help people when you see an issue. If you can't find a solution, you can become the solution, in my opinion. But thank you so much for coming on.
yes. Thank you for
I
having
really
me. This was
loved
fun.
it.
I appreciate the platform. Awesome, mind your
Of
mental
course,
platform.
the best thing, honestly, the best thing I got out of that conference is networking. I mean, it was a great conference, guys, but the
Yeah,
best thing I got were emails and phone numbers
and
from
people that
people.
I'm still in touch with today.
Yes, I'm still in touch
After
with every
several
single
years
person.
of spending a week together in like dorm rooms for a week.
Yes, dude. Oh my god. Let's not was
Sure.
that was the one with the terrible shower. I wanted to
Yeah.
flip. Oh
It
my
was
god.
a terrible show.
And it was not and it was not
It was a floor.
but
It was
anyway,
a
let's not
floor and a
even go there.
curtain. But yes,
Yes, it was the y'all, like, the shower was just a floor and a curtain. It was insane. I
it's
was like, "What
terrible.
kind of mess? Did my deposit pay for this? This is what my deposit paid for?" It was crazy. But thank you so much. And guys, as you know, you can find us anywhere you like listening to a podcast. I know there's iTunes and Spotify, but there's also Overcast, Acast, Podbean, everywhere. So if you can't find us, you are not looking hard enough because we're everywhere. And if you have any questions, feel free to send them to mindyourmentalpodcast@gmail.com. Thanks so much for tuning in, guys. I don't know what that was, tongue twister. Thank you so much for tuning in, guys. Words are hard, and remember to be kind to yourself. Thank you.